Hello ladies and gentlemen of the Gent online community of the Lightening Up Weight Loss Program. Today I'm going to be doing a much waited for presentation. It's going to be covering a topic that we very commonly talk about in the weight loss industry, particularly in when we are approaching people for the first time. How do you approach a patient as a medical professional, and how do you approach the subject of weight loss, and what do you prepare for them? So basically I'm gonna this is what when we train people, when we are trained in obesity medicine, this is what we use, and I'm going to start right now. So right before we start that, folks, you see on my screen here the little spinning wheel. I am going to spin that wheel and let's see what we have to do today. How is it gonna do? Are we gonna have to do some push-ups? Are you gonna have to? So you're gonna have to like this video. So go ahead, folks, go like this video, and that's you know, you like the video, the boss there that has 9,001 HP, it's gonna start losing HP points in the future. When when we start getting a big enough public, it's actually gonna be streamed out live. I am streaming this live right now. There's not a single viewer, so but you're gonna be able to watch these videos on the 5 A's. That this is a good study point when you're practicing for the obesity medicine board. So now I'm going to start, and let me see why this is not working here. There we go. Alrighty. So how to approach the weight loss patient, the 5 famous A's. So first of all, not one of the worst things that you can do is you can start talking to somebody. Oh, listen, you need to lose weight, even if you have the best intentions in the world. A lot of people will take this as a tremendous offense, and the reason is there's a lot of stigma. Society has a lot of stigma. And even though you may not be wanting to insult them, and you may have the best of intentions at heart, people have a lot of stuff that they've been bringing up, through a lot of trauma, unfortunately, and they will not take necessarily what you have to say with the best. They're going to kill the messenger or beat him up pretty bad, and that means you. So not everybody is ready for change. That's another thing. Not everybody wants to change. Some people are actually quite comfortable by the way they look. Their partner is very happy with them, and what you may offer them is probably not something that they want. So the first thing that you have to do is actually ask for permission to discuss body weight. This is the absolute safest thing that you can do, and in fact it has been put into the 5 A's. The 5 A's are basically the algorithm of what we do when we approach a weight loss patient. Okay, it's the 5 A's. What do you do when you go see a weight loss patient? The 5 A's. So it's the first part. You basically you have to ask for permission to discuss body weight, and nothing is better perceived, in my opinion, than going from a respectful standpoint. You're not approaching the person from a judgmental standpoint, but rather you're being professional, you're being medical. And once you give, if they give you if they respond, yeah, sure, let's talk about it, I'm okay with that, then you can start going into the knowledge that you have. Then you can start presenting and see how they react to it. But never assume anything. Ask for permission. And this, folks, it doesn't come naturally. You have to train yourself to say, the first thing I'll do, if you have a patient that comes in with high cholesterol, diabetes, high blood pressure, and that you feel personally well, or you have a BMI, or you see this person is obviously that has an issue with weight, or somebody comes in with a lot of knee pain that just never seems improved, and they have a BMI of like 37 or like 45. You as a physician, I mean, you have to offer a little bit more. But then the best way to go about, if you think that weight has to do with the ongoing problem, is it okay for me to talk about, is it okay for us to discuss about your weight, you know? So by the way, folks, practice saying these things. That's something that I do. I will bring up scenarios, you know, in my head, and then I will play it out. How do I, if this happens, how do I respond to it? I do that. I hope that you will do that yourself as well. I think it tends to help out. It tends to smoothen out communications when we try it out between people too. Now, how do they respond to you? So this is the second part of the first A. You have to assess their readiness for change. If they say, I'll think about it, you know, is it okay for us to talk about your weight? I'll think about it. You know, this actually happens quite often. Some people rather take medications for high blood pressure, diabetes, high cholesterol, or they don't know, or they don't want to treat the underlying problem. You know, in some of these cases, it's like smoking. You know, they're okay with taking pumps for lung disease, you know, breathing treatments, but they don't want to stop smoking. This actually happens. People are free to choose what they want. So. But you have to be there to be able to offer some education as well, and just be on the lookout. But the idea behind it is that you have to assess their readiness for change. Okay, so first ask for permission, and if they say okay, then you have to look how ready are they for change. The idea is that what you can offer, the idea behind it is that when you start looking for their readiness for change, is that when you have a patient that has multiple conditions, and I personally am a strong believer in medications. I actually, and the more you study into the obesity medicine field, you see that medications actually work tremendously. It's definitely one of the best things out there. At least if you have to lose 5 to 15% of your weight, then medications are a strong asset to have on your side, along with, of course, diet and exercise and all that, but they work very well. So in terms of a patient, you know, the way that we teach this in the obesity medicine courses is that basically it's like a hand. You can give a medication for high blood pressure, 2 medications for diabetes. You have to give a medication for I don't know, something else, and then you have to treat sleep apnea with the CPAP machine that works at night. But if you cut the disease or the trunk of the tree, you know, then the entire thing falls apart, and then you don't have to treat with 15 medications. Then you resolve the problem. So the idea is, this is why you have to look out for the readiness of the patient, because you may be able to fix a lot of different conditions by simply, you know, fixing the base problem. So this is why it's very useful to try to assess the readiness of the patient. You know, ask them for, you really have a good goal at heart. So you know, somebody's coming in for depression, they're overweight. Well, listen, you're twice as likely to be, you know, to suffer from depression, mood disorders, personality disorders, with when you suffer, when you have a BMI of above 30. So is this something that you should then look into? What happens when you have a BMI below 30? Is this something that improves? Well, yes. So certainly it's something that you should at least consider in some of your patients. So then, you know, the patient, you know, they looked interested. They say, yeah, well, listen, I'm interested. So then, okay, so now you ask for permission. You know, they are interested. Then you need to start looking into the patient himself. So who is this patient that's sitting there now in front of me? Well, now we have to look into the different classes of obesity, really, and the way we do that is through measurements. It's not it's not the way you look. Oh yeah, you look chubbier than this other person, so you need more medication. It actually works out with BMI. The BMI classification I think it's the world standard classification. It works excellent, at least for medication purpose. If you have 27, folks, the treatment basis for obesity is actually is not the parameters and what we use, the indications for treating excesses in weight are really not that difficult. If you take into consideration the amount of the amount of population that are overweight, folks, means basically BMI above 25 in Canada. We have about in Quebec, actually in Quebec, the province where I am right now, we have about 20% of the population that is obese. Of that 20% of the population, it's I would say less than 10% are being treated for obesity, and most of these people have some metabolic problem where it's pre-diabetes, which is highly, I mean, it's very common, non-alcoholic, liver, the hepatosteatosis, so basically fatty liver that's not alcoholic, and basically what happens in these patients is that the liver, the cholesterol will just kind of start spiking up in your liver. It's like, well, I can't really put it anywhere else, I'm just gonna put it in my pockets, and your liver starts getting big, and on ultrasound we can actually verify that. And this now is becoming one of the main reasons why people are getting liver failure and liver transplants in the US. So all these things that are related to basically obesity not being treated, not even being assessed properly, is part of the issues that we have. But so this is what you do basically in this assessment. You look for the parameters, you look at the BMI, because it will guide treatment. So simple. You have a BMI above 30, you give treatments, you give medications to the patient. Folks, a BMI above 30 means basically a diagnosis of obesity. Somebody that has BMI above 30, and you can go online, you can go to our website, ellegenspa.com, and all you need to do is measure your height and your weight, and you will get your BMI. And you can see if you basically have the indications for treatment for obesity. The reason why it's so easy to qualify for treatment for obesity is that you have a lot of benefit to gain, and you are a lot at risk for other conditions if you are not treated at the same time. So there's a lot of medications nowadays, and what needs to happen after is that you need to sit down with a physician. They need to find out the reason why your weight, you've packed weight throughout the years, and then that's eventually how we actually see if it really is proper for you to get on the medication. Do you have a cause that needs treated, and then you treat the cause and the obesity goes away? For example, sleep apnea. Is your problem sleep apnea? Some people, or is your problem low testosterone? Some men have hypogonadism. Their testicles aren't producing enough testosterone, and sure enough, they start getting all this weight, and then you treat that, and sure enough, it goes away, and the weight starts regulating itself. So there's a lot more to this than just take a pill and fix the problem. But this is the part of the initial visit for obesity, wherein you start getting all this information in the phases of getting a treatment plan for a patient. So in this same assess the parameters. Part of the parameters is not just the waist circumference. The main things that we use for an obese or a patient that you're assessing for obesity is the waist circumference, the neck circumference, and the BMI. If you get these three things, you basically have not only a classification for the patient, but you have risk stratification and you have treatment parameters. So you can already tell, well, maybe you can do this for this patient, maybe you can do that. You can even have indications, or you can even orient your patient. If you're somebody that likes to do aesthetic medicine within the obesity medicine, you already know that, well, you can do this or you can do that type of technology on this patient, because some of them have limitations as it comes to body mass index. So the other thing, part of the assessment that you have to get is, what are the parameters? What are the particular things of my patient? Does my patient have ovarian cancer? Does my patient have osteoporosis? Because all this influences tremendously when you treat a patient. If your patient has osteoporosis, you don't want to have them lose weight too quickly, because this will accelerate the osteoporosis process. The same way, you have to check into this is the beauty of medicine, actually, folks, and this is why I hope all of you will learn a lot from watching these videos. But this is part of the first visit. You know, you asked for permission, they agreed. So now you're assessing, you know, the parameters of the patient. So now you have all these parameters. You start doing your advising. So basically, what you have to do is you have the parameters. You start customizing, you know, their weight loss strategy. You need to know basic things regarding weight loss. And if the patient has depression history, anxiety, mood disorders, are twice as likely to suffer from major depressive disorder and the above, anxiety and personality disorders as well. They are 1.5 to 2 times as likely if they have if they are obese, folks, or if they have a BMI of above 30, just to give you an exact number. Also, you need to learn the benefits of losing 5 to 10% total body weight in order to give proper advice to these patients. Now, I will create a video for this, as I wrote here, and I will review these individually. There's clear benefits, and in this, you need to be able to, once you know these information by heart, you're able to customize it for your patient. Patient comes in, you look at their chart, very simple. This guy has had heart, you know, only problem they've had, very common heart disease. Folks, most common cause of hospitalization, most common cause of death in the world. So heart disease is something that you see very often. It's certainly something that you're going to see far more in the future, because the more people survive heart attacks, the more they get hospitalized for, you know, complications of heart disease like heart failure and so on. So they just live longer. So it's something that doesn't go away until we'll get the perfect, you know, cloned heart transplant or whatever. So but anyways, until then, you're going to see a lot of sick people with heart disease. So you need to know what are the benefits from losing weight from the atrial fibrillation standpoint, for congestive heart failure standpoint. You know, how do you dose the medications? What's the best medication for that? Which should be the first medication you give from the weight loss standpoint in terms of treating high blood pressure? Is it a beta blocker or is it an ACE inhibitor? I mean, you'll get to learn a lot of this stuff, but and so if I'm a mechanic, here's a small example of that, and you tell me, well, you're going to become a better ballerina, I'm not going to care much. But so you need to become familiar with the improvement in quality of life and treating obesity brings, and then you need to become familiar with the medical history and the quality of life issues of the consulting patient and what they have. So in this way, you'll be able to create expectations around what is relevant to them and the problems in a problem-focused approach. You'll be able to better formulate a follow-up around the goals of the patient if you do this properly. So basically, the patient comes to you like this. The reason why the patient comes to you is to lose weight, but the patient is like this. The introduction to you is the weight loss. You know, they're like, you're the weight loss doctor, but really weight loss is like this, is the intro. And weight loss comes with a bunch of other problems, usually metabolic in nature, that you can see through insulin resistant, high cholesterol, diabetes. These are problems that you treat. You have the knowledge through internal medicine, family medicine, whatever you study, endocrinology. But from quality of life, there's another set of problems that come in. Oh, back pain, I'm always sad. Life isn't just the same anymore. I don't fit in my clothes. People are mean to me at work, etc. You know, you can name it. There's a lot of social stigma. But the idea behind it is that you are somewhat of a problem solver, and some of these solutions you can actually provide them for the patient. So you'll need to know which of these, you know, for example, you can get a patient off of insulin when you treat their obesity. Folks, the American Diabetes Association says there is only one cure for diabetes, for type 2 diabetes, and it's bariatric surgery. To say after 2 years of bariatric surgery, about 98% of patients are completely off insulin and off diabetic medications. Pequeño, puedes bajar ahí, por favor, estoy filmando. So that's it in a nutshell. So when you have the knowledge around that, you're able to formulate the goals, and you can orient the patient. Then again, you know, folks, we see this all the time. You are able to get people off of insulin, and you have to be able to create and choose the best medications for a patient in order to achieve that. Weight loss works. So the last A, okay, so we just saw advise. The last A is agree. This is the actual, the patient has to agree, you know. So what do they agree to? You just gave them, you basically told them, listen, you're gonna get this, yeah, you know. Basically the patient came in, said, is it okay to talk about your weight, you know, and they agreed. Then of course, you know, you did the education. Well, there's several things that can happen. You looked at their medical history, said we have all these problems that we can work around on, and we could probably help to solve them. Furthermore, then you start getting the parameters, right? The assessment component. Then during the assessment component, then you did your assessment. Then you did the advisor. You advised the patient. And now you are at the last phase, which is the agreement phase. The agreement phase is basically where you have to put things into a program. Very simple. The agreement phase should actually be done before you even see your patient. My advice for physicians is to actually work on this and to have a protocol based approach. There's an Iowa protocol for weight loss, which is taught by Dr. Ratter, I think is his name. But it's also taught at the American Obesity Academy. He gives presentations there, and we can actually go get extra training with him. And he actually built his entire computer system. But regardless, what I'm trying to say here is that the patient, you just share with you know, some of their intimate information. I have this problem, this problem, this problem. My life is like this. My life is like this. My life is like that. And your solutions are not really concrete. Your solutions are, we're gonna take pills, we're gonna do exercise, or we're gonna lose weight. It's not concrete. How much is this gonna solve these problems? It's not really concrete. So part of the agreement phase is where you tell your patient, listen, this is like, in essence, you're going to be fixing these problems slowly but surely. But one thing that I always tell my patients is that this is something that is done gradually. Obesity, you don't go from an 18, a 19, 20, 23 of BMI to 34 of BMI in 2 months. It takes quite a lot of time. It takes years. It should take the same amount of time to lose the weight. Now, we all want quick results, but reality is that the body is an engineering system. The body uses hormones. Hormones take a long time to get fixed. If you lose 50 pounds in 2 months, you're gonna get some of that body weight back because your body is working on the hormone levels of the past. So the balance is not something that gets disturbed and completely changed in a small amount of time. When you stop weight loss medications, no matter which ones you take, you will always gain some of that weight back. And this is because the balance is never completely changed. And sure enough, it's not changed in 6 months, and it's not changed in a year. The ghrelin hormone, the leptin hormones, the appetite hormones, they remain pretty much the same for long periods of time. So even when you change your diet, folks, so everything has to come in a conjunction. Basically, it's everything together that needs to move in a direction for your weight to reflect the change that you want to have. So your sleep has to be appropriate, your exercise, your lifestyle, your stress level, your etc. That's it in a nutshell. I hope you guys enjoyed this video. These are the 5 steps that you all have to go through. But basically, just to finish reading here, this is what I do for the patients. I will tell them, basically, this is our protocol. The first month, we do a very low calorie diet. Then we can start with this medication according to your BMI. Then you can see a nutritionist every 2 weeks for now. You do a body impedance analysis scan here at this point in time. You do calorimetry there. We follow your progress through the Elle, Gent body impedance, the home body impedance analysis scan. That's also linked to your cell phone, by the way. You follow your results daily. and then you also follow your podometry and your sleep habits. You know, if you slept 3 hours in a day, you know, for us that's a red flag, because you're far more likely to develop obesity if you're actually if you're sleeping less than 8 hours. 6 hours, you're at higher risk for gaining weight. You're actually going to be gaining weight, and the leptin and ghrelin hormones actually go in balance to help you gain weight. It's like your body's going to punish you. And folks, this is what the studies have shown. So regardless of what we want, sleeping less, and you know, as the years go by, people sleep less and less, and sure enough, what happens to people's weight as they get older? It goes up. So you have to take, you know, your sleep sacredly. You have to, you know, you have to sleep. You have to do all the good things in life, like exercising and eating well. So you can see the program calendar that we have. You can do a copy, do one for yourself, follow it, take it for free. It's on our Facebook group page. And that's it for this video. Once again, these are the first few videos that I'm doing. The ones in the future are going to be a little bit better. Like the video, subscribe to our group, to this channel, and hopefully you're gonna help us with the donations. Here you see we are at 2 subscribers. Or my goal is for us to have at least 100 subscribers by the end of January. Then again, I'm gonna be doing videos mostly on a daily basis, at least one video. By the way, folks, you see this white thing right here? This is something that I recommend if you live, like, look at me, folks. This is a small apartment. I live in a condo in downtown Montreal, so I don't have a lot of space, but I grow my own vegetables. I use this machine here, which is, I'm going to do a video on it later on. This machine is called, man, how's this thing called? Tower Garden. Let me show you something. I have an affiliate account. If you want to buy one, you're actually going to get a discount. The Tower Garden allows me to grow, I had like 5 types of salads: kale, bok choy, 3 types of tomatoes. I had a bunch of salads about 2 months back, and then I left for a trip and I turned it off and everything died. So that was a mistake. Actually, yeah, it was a problem that I had here. So, but anyways, I received the new pockets of wool rock, whatever that's called. That's something that we grow. But anyways, this thing, folks, it's plugged to the wall. I put water now, and then I put water in 3 weeks, and I do absolutely nothing. I mean, I put the ammonia and basically the food for the plants, and I do absolutely nothing, and it just grows the vegetables with the pump, which makes the water circulate in that tower all throughout. And then these things here are lights, which basically grow food. And no, I am not growing weed. That is correct. I am growing vegetables. But the idea behind it is that I am saving quite a lot of money. I'm paying about 60 bucks a month for now, but once I'm done paying that for 1 year, this machine is mine for life. And I have basically a method to grow vegetables with, you know, when my son is here, we get to pick tomatoes together and all these fun things. So I highly advise it. I'm gonna leave my affiliate account number down so you can, you know, get the discount if you want to buy it. And you know, wish you all the best, folks. So use the 5 A's.